Bismillahirrahmanirrahim. Hello students, I hope that you have had a good Eid. Happy Eid to all of my students, and I hope you're safe. Stay home, stay safe. So we will resume our online teaching program in surgery. The first topic after Eid and today is peripheral vascular disease. Today, the outline of the lecture is that we will discuss the definition of peripheral artery disease, the causes of peripheral artery disease, the spectrum of peripheral arterial disease, and investigation and management of peripheral arterial disease. As the word says, peripheral arterial disease, it is the disease of the arteries in the periphery. By definition, arterial disease below the level of the renal arteries affecting the legs is called peripheral artery disease. The magnitude is quite large as 10% of population is affected by peripheral artery disease, and the percentage increases as the age increases. Above 75 years of age, 20% of population is affected by this. Peripheral artery disease is basically a disease in which the blood flow in the limb arteries are obstructed. As you can see in the picture on the side, that in normal artery the lumen is wide and the flow is normal, and on the diseased artery, due to atherosclerosis, the lumen is narrowed and the blood flow is decreased. Commonly, the lower limbs are most affected, and these arteries are obstructed due to plaque deposits of atherosclerosis, which reduce the blood supply. This is a gradual process. Sometimes it can suddenly happen when there is overlying thrombosis on embolus in the already narrowed arteries. What happens, the mechanism is that first of all, the blood flow is hampered due to the narrowing of the lumen. Along with that, there are some microvascular changes which happen, which are caused by increased flow and damage to the endothelium, which leads to plaque formation and can further lead to platelet aggregation, leading to embolus and thrombosis. The pattern or the progress of peripheral artery disease, it starts from compensation by peripheral collateral arteries development due to angiogenesis, and when they are also overwhelmed, then it becomes rest pain, and if still no treatment is offered, it can change into chronic non-healing ulcer followed by gangrene, and if still nothing is done, it can end up in amputation. So it is a gradual long-standing process which can be treated. The causes of peripheral artery disease are atherosclerosis, thrombosis, embolus formation, and inflammation of the arterial wall, as in arterial diseases called arteritis, which are autoimmune, and other different causes for this. So whenever there is a case of peripheral artery disease, we have to keep in mind atherosclerosis is a long-standing or gradual process. Thrombosis can be sudden on overlying atherosclerosis. Similar to embolus, it's a sudden process. Inflammation is waxing and waning, can be treated. And there are certain risk factors for peripheral artery disease. Some are modifiable, some are non-modifiable. The most common is smoking. It is said that if you continue to smoke, you will lose your limbs. Hyperlipidemia, hypertension, diabetes, homocystinemia, these all are modifiable. Smoking can be quit. Hyperlipidemia can be treated by antistatins. Hypertension can be treated by antihypertensive, diabetes can be treated, and homocystinemia also. Non-modifiable factors are male, gender, and age group. These cannot be modified. Now the spectrum, it goes from asymptomatic to acute limb ischemia. Asymptomatic peripheral vascular disease is the most common. Then it develops to intermittent claudication. Then it will develop into critical limb ischemia, and then acute limb ischemia. If still not dealt with, it can lead to limb loss or life loss even. So it is a serious disease. Now, any patient coming with peripheral artery disease, we will need to investigate this patient. The necessary or available investigations are, the first line is Doppler ultrasound studies. It is more or less like an ultrasound examination, which is non-invasive and tells us about the anatomy of the blood vessels and the function, which is determined by the flow of blood. And MRA, which is MRI of the arteries with contrast, in which the whole map of the arterial tree can be seen. It is also non-radiating and has its own limitations, but gives us a good map which can be interpreted by anybody like surgeon or radiologist. CTA is a CT scan of the arteries. This again, an image is taken and 3D reconstruction is done to evaluate the arterial tree. Digital subtraction arteriography is a angiography or a picture of the vessels in which all other soft tissue are subtracted digitally. So the picture we get is only of the vessels. Serum lipids, glucose, and homocysteine are to evaluate the risk factors. Management of arterial disease, the principle of treating is that we do lifestyle changes to deal with the modifiable risk factors like weight loss, quit smoking, graduated exercise, and diet modifications. Medical management is again for comorbid diseases like hypertension, diabetes, and hyperlipidemia. And most importantly, revascularization, in which we can increase the narrowed lumen by endovascular techniques, which include angioplasty, stenting, or open surgical methods, which are bypassing the occluded area or doing an arterectomy to increase the lumen surgically. So, in any peripheral vascular disease, these are the three things to be done: lifestyle changes, medical management, revascularization. Medical management also includes antiplatelet therapy, which prevents any thrombosis or embolism. As I mentioned, lifestyle changes are quitting smoking, exercise, and weight loss. Medical management includes antistatins, antihypoglycemics, antihypertensive, antiplatelet or anticoagulation, and vasodilators. Revascularization is done by open surgical bypass, arterectomy, or endovascular techniques using angioplasty, in which the narrowed lumen is dilated with the help of a balloon. And also, embolectomy can be done for acute cases of embolus. The first, as we mentioned in the spectrum of peripheral arterial disease, is the asymptomatic one, and the next stage is intermittent claudication. Intermittent claudication, by definition, is a cramping muscular pain in the lower limbs, which is induced by exercise and which is relieved by rest. It is relieved by rest, and the area of pain represents the location of obstruction. This can be seen in the picture, that when there is pain in the buttocks, the area of obstruction is the common iliac artery, When the pain is in the thigh, the area is common femoral artery where the occlusion is. When the pain is in the calf, there is superficial femoral artery pain. When there is pain in the buttocks, thigh, calf, all of the lower limb, then usually the occlusion is at the level of the aorta. So by taking a careful history, we can find out the approximated area of occlusion. So a good history gives us an indication, and also the distance after which claudication start is called a claudication distance. As the disease progresses, the distance the patient can walk before this pain starts gradually reduces. And how do we assess a patient with intermittent claudication? We perform ankle brachial pressure index, in which the systolic blood pressure is measured at the ankle level and brachial level. Doppler ultrasound, MRI of arteries, CTA, and digital subtraction angiography is done to measure or evaluate the level of obstruction and the extent of obstruction. Again, three steps of treatment are lifestyle changes, quitting smoking, exercise plan. Medical management is clopidogrel and aspirin, which are antiplatelet therapies, antistatins, and antihypertensives are done. Revascularization. Endovascular techniques are used where there is the occlusion is suprainguinal. For infrainguinal occlusions, usually surgical bypass is quite useful, in which the occlusion is bypassed with a vascular graft, in which a graft is taken from the proximal to the obstruction and it is reanastomosed distal to that, in which way the blood bypasses that occluded area. Usually, the occlusions which are small in length can be dealt surgically, but if they are quite long, or the length is quite significant, then endovascular techniques can be used successfully. And after that, if intermittent claudication progresses, the next phase of the disease is critical limb ischemia. Critical limb ischemia has been defined as ulcers, gangrene, or ischemia, and characteristically rest pain for more than 2 weeks. So, if any of these features like ulcers, gangrene, or ischemia, or rest pain for more than 2 weeks is present, then it will be labeled as critical limb ischemia. It means that the limb is critically ischemic. If not treated urgently, the chances of loss of limb or loss of tissue will be quite significant. Assessment is again the same: pulse examination, ankle brachial pressure index, Doppler ultrasound, MRI, DSA, and CTA is done. Medical management is the same again. And if critical limb ischemia continues, it will develop into acute limb ischemia, which is characterized by 6 features, 6 P's of ischemia: pain, paralysis, pulseless, perishingly cold, pallor, or paresthesia. If these things are present, you will diagnose the patient as a case of acute limb ischemia. This is a surgical emergency. If not treated within next few hours, it will lead to loss of limb, as it is defined as a sudden decrease in limb perfusion that threatens the viability of the limb. It can suddenly caused by thrombosis due to rupture of plaque, or an embolic phenomena in which the embolus arises from the heart by arterial fibrillation or MI, or from an atherosclerotic lesion, and it can be due to arteritis, and it is characterized by 6 P's as I mentioned prior to this. Urgent assessment is done by duplex ultrasound or CTA, and the management includes immediate heparinization by 5,000 units of IV heparin, which will prevent any further thrombosis. Surgical revascularization is done by embolectomy or arterial bypass, and very occasionally endovascular techniques can be used. So, this was all about peripheral arterial disease. In summary, if I have to describe the what is peripheral artery disease, it is a circulation problem in which the arteries carrying to the blood, legs, or even upper limb can be narrowed and blocked. You can see here that the lumen is quite all right, but as atherosclerosis develops, lipids get deposited in the arteries and the lumen gradually narrows down and the blood flow decreases. The risk factors are smoking, diabetes, obesity, hypertension, high cholesterol level, sedentary lifestyle, and family history, and sometimes metabolic disorders such as homocysteine. Symptoms are painful cramping, leg numbness, weakness, coldness in the lower leg, ulcers on the feet which do not heal, change in color of the legs, loss of hair, and shiny skin. And in aortic lesions, it can present as erectile dysfunctions also. And the simple test on clinical examination which can be done is the feeling of pulses and ankle brachial pressure index. And the diagnostic test, as I mentioned, the non-invasive tests are ABPI, duplex ultrasound, MRA, CTA, and invasive test is digital subtractive angiography, or in common words it is called angiography. And the treatment options which we have are, first of all, medical management, in which the risk factors are modified, like smoking should be quit, obesity is treated by weight loss, graduated exercise, anti-hypertensive, anti-diabetics, anti-statins, and antiplatelet therapy, anticoagulant, or in some cases even vasodilators are given. And for revascularization, endovascular therapy is done by transluminal angioplasty, stenting, and sometimes atherectomy is done. And surgical treatment includes bypass grafts and arterectomy, embolectomy, and if there is non-viable tissue or loss of tissue, then amputation is sometimes helpful. So, to just to remind you that peripheral vascular disease is an important disease, and remember, pain, paralysis, pulseless, perishingly cold, peril, or paresthesias are the 6 P's of ischemia. This is a common disease which we see every now and then in our surgical OPDs. Many patients suffer from diabetic foot infections due to peripheral vascular disease. So, I hope that this small talk would have given you a basic idea about peripheral vascular disease. It has 4 stages: asymptomatic, intermittent claudication, critical limb ischemia, and acute limb ischemia. So, our next lecture will be about diabetic foot infections. Thank you very much.